Thanks for coming today. We today are joined virtually from Gaza, if I'm not mistaken, by Dr. Rik Peeperkorn, the representative of the World Health Organization there and for the West Bank and Gaza. And he's here to discuss the polio vaccination campaign over there. Dr. Peeperkorn, thank you so much for joining us. Please go ahead, and then after your introductory remarks, we'll have some time for questions. Just to let you know, we are a little short on time, so make your questions quick and concise. Please, Doctor, go ahead.
Thank you very much. So greetings from Gaza. From the WHO, I was in Deir Bala. I actually just returned from another mission to the north of Gaza. And I want to focus on two areas. So I will take some time because this is complex. I want to focus on the health in the north of Gaza and on the polio campaigns. I want to start with health overall. So in October, many WHO humanitarian missions to the north were cancelled or impeded. But over the last 3 weeks, WHO managed 7 missions to the north, 5 missions to specifically, and you saw it a lot in the news, Kamal Adwan, and yesterday also in al-Awda hospitals. I participated in 4 of these missions. 2 other missions, large missions, were to Gaza City and their health facilities. So these, just to be specific, these WHO-led missions, what do? They deliver fuel, medical supplies, blood, some food and water for patients, etc., when we are facilitated. Sometimes we are not facilitated to do this. With our partners, PRCS and CADAS, we also internally medevac 109 critical patients in this 5 missions, or the 7 missions specifically, and 111 caregivers to Shifa Medical Complex and to the south. We also facilitate emergency medical teams, the placement of them, support 2 of them whenever it's feasible, for example, this time to Shifa and al-Ahli Hospital. We plan this week a large medevac outside Gaza for critical patients to go outside Gaza. Now, I just want to reflect something on the north specifically, and I'm reflecting through the mission I just came back from yesterday. It was to Kamal Adwan and al-Awda. So despite the dire conditions, we managed in Kamal Adwan to deliver this medical and surgical supplies for 7,000 interventions, 150 units of blood, 20,000 liters of fuel, 60 boxes of food and water for patients and staff. And we transferred 25 patients and 37 companions. In 10 bombardments, very close to the hospital, and debris hit also the convoy, and no major damage. Shortly after the WHO missions left Kamal Adwan, and you must have heard this as well, it was reported the facility's 3rd floor was hit again, injuring 6 children and who were patients there, and 1 child with a sustained critical injury. If you look at the...
Wait, I think we may have lost the connection for a second. Let's give it a moment. Yeah, we may, okay. Well, this is what happens when you're connected from such a remote location in wartime. We'll see if we can get him back. We'll try. He's in Gaza, yes. Which would would explain the connection. Let's see if we can get him back. Okay, he's reconnecting. So he's trying again. Okay, I see. Okay, we have you back. Wait, can we can't hear you. Hold on. I think you're muted. I think he's muted. Can you unmute your mic?
Okay.
Oh, there we go. Okay, great to have you back. I think you were
Sorry.
talking about the medevac, the 7 missions, and then you were gonna go on.
Okay, let me then, finish that. I just want to finish on
Yeah.
Kamal Adwan. So as the director, Dr. Hussam, I mean, clearly stated what is really needed is, he needs emergency medical teams, he needs surgeons, orthopedic and vascular surgeons, because their emergency department is full of patients and they don't have a proper surgeons. 40 casualties at first count. What is, of course, what he also, and he made this plea very clearly to the international community. The first thing they want is protection of the hospital. The second point he wanted, WHO comes regularly with fuel, medical supplies, blood, food for staff and patients. So after al-Awda, a couple of blocks down the road, horrible conditions, roads, destruction, there's al-Awda hospital. We managed to reach there, and we transferred 5 patients as well there and 5 caregivers. The same problem with that hospital, and this was actually really sad because in this hospital we were not facilitated to bring in medical supplies, surgical supplies, and medication. We had the plans and everything was there that we would deliver 10,000 liters of fuel, deliver 30 boxes of food, medical supplies, etc. We were not facilitated nor allowed to bring that in. So this director, Dr. Mohammed, was desperate and disappointed as well, that we only could take out the agreed on critical patients and not bring anything. And I want to just stress how dramatic the situation in the north of Gaza, at least, is currently. There are 3 hospitals there, Kamal Adwan, al-Awda, Indonesian. Indonesian hospital is not functional anymore. Kamal Adwan and al-Awda are minimal functional. Al-Awda is probably will be, if we are, WHO plans another mission later this week, if you're not allowed, if you're not facilitated, that hospital will be very quickly out of service as well. So again, we are ready. We need regular access, properly supported and facilitated. And I think also we almost, and having been in this crisis now and working for 1 year and coming and going to Gaza, we sound like a broken record, 1 year in this crisis, and we should not. Let's switch to polio. So just to remind everyone what the campaign was about. I wanted to start with health because, of course, health overall is what it's all about. And polio is an important component of this. So the campaign aimed to vaccinate an estimated 592,000 children almost under 10 years of age with a second dose of the novel oral polio vaccine type 2. And vitamin A is also co-administered in this rounds to help the boost overall immunity among children between the ages of 2 and 9 years of age. We had, and that's successful implementation of this first round and the first 2 phases of the second round in central and southern Gaza, where we have a coverage of over 95%, both in polio vaccination and vitamin A. Now, the campaign in the north, you probably might recall, just started 3 days ago, the 2nd of November. It was postponed from the 23rd of October due to the lack of access and assured comprehensive humanitarian policies, and also because of the intense bombardment, the mass evacuation orders from the north, etc. So the area-specific humanitarian pause necessary to conduct this campaign had substantially been reduced to basically Gaza City. So compared to the first round, that area was much smaller. The technical committee, and it consists about all the polio part, the Ministry of Health, WHO, UNICEF, UNRWA, and many parties still decided to go ahead after a pause to do as good as possible, to cover as many children as possible. And it is a bit ironic that what we have seen in the last weeks, that at least 150,000 people now estimated have been forced to evacuate from the north to Gaza towards Gaza City for safety. And that is, in a way, good for the polio campaign because indeed we covered many more children than expected. We still will miss the children remaining in Jabalia and Jabalia Camp, Beit Lahia, Beit Hanun, etc. But those are smaller. During the campaign, I met, first of all, I was really impressed with still the enthusiasm of parents and children to bring their kids for polio vaccination to receive vitamin A. So the target for the North is 190,000 children. And after the first 2 days, we already covered more than almost 94,500 children under 10 with polio, which is almost 80%, 79% of the target. And 75,000 children got vitamin A. So this is higher than in the first round, at least for Gaza City, because of all this, again, internally displaced people coming from the north. And I met many families, having been 4 times in Kamal Adwan, who recognized me, fathers, mothers, children who recognized me from Kamal Adwan and were forced to flee after the siege there. The shelter conditions for all those people, by the way, are incredibly basic. So much more is needed. I want to stop here. I think I tried to cover the situation of health in the north of Gaza and focus on polio as well. Over to you.
Thank you so much for that, Doctor. We'll start over here with Edie, please.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. You said that, and I quote, "We were not facilitated in bringing in supplies to the hospitals." I assume that this was Israeli authorities, but who and why and what explanations were you given? And can you tell us the state of operations of the 3 hospitals in the north today?
Thank you very much for that question. So first of all, I said already that for WHO, and it is not just for health, it's also when you would talk to my colleagues who work, UN colleagues, WFP or UNICEF, who work in food security or WASH or other areas. There has been very few missions to the north in October. A lot of these missions indeed got cancelled, got impeded, got delayed. We managed, and I'm really proud of that. I told it that we at least over the last 7 weeks, we had 7 missions. Yes, they need facilitation by the Israeli authorities. Now, a number of these, 2 of these missions, and I was also really surprised myself, one of these missions, we were completely ready with the medical supplies and fuel and food for staff and patients once to Kamal Adwan. And on the last moments, we were not facilitated to bring this. We pushed this, we regularly pushed it, all levels, no clear reasons given. Other missions were facilitated as I described, So there's definitely we coordinate, etc. Some missions get facilitated in a more proper way. The mission yesterday had this other twist that we were not facilitators to bring some of the supplies to that other hospital, al-Awda hospital, which is currently, they only can run the generator for 2 hours a day. And al-Awda hospital, I'm really concerned. If we will not be able to deliver fuel and supplies later this week, this hospital indeed will become non-functional. Now, I want to stress the same for, if you look at the north of Gaza, there are 3 hospitals there, Kamal Adwan, al-Awda and Indonesian. Indonesian is out of service. Kamal Adwan and al-Awda is what we would call minimal functional. There's no primary healthcare, functional primary healthcare centers anymore in the north, in that part of the north of Gaza. nor medical points. So that's the current situation. Over to you.
Can I ask a quick follow-up? On yesterday's attempt to deliver supplies, what reason was given that you could go and evacuate patients, but you couldn't bring in any supplies?
So let me say about yesterday's missions, because I want to say something positive. That was a relatively, for us, because a lot of those missions are, well, it's, first of all, there's a lot of bombardments, etc., going on, and sometimes they are unnecessary, completely unnecessary dangers. Yesterday's missions was, at least for me, a relatively easy one. I didn't come back at midnight. I didn't come back early in the morning. So we left and we came actually back at 8 or 9 o'clock in the evening. That was a relatively, and that was actually only to Shifa, so it was from the north. We were facilitated to bring those supplies in, and I described them, and I think otherwise I will describe it. We were facilitated to bring in the 20,000 liters of fuel, medical supplies, surgical supplies, anesthesia medication, and blood, and some food for patient staff to al-Awda, and to assist and facilitate this transfer, what we call internal medevac, of these critical patients. That was in Kamal Adwan. Al-Awda, which is a few blocks away, it's, when the roads are completely, it's difficult, and has a different function. For al-Awda, we were not indeed facilitated to bring these supplies. I don't know the reasons. I've raised it multiple times at all levels, etc. And I cannot comprehend that, because those hospitals should remain functional. I mean, specifically in the north, the health situation is dramatic. And if you then had only 3 minimal functional hospitals, and currently you only have 2, you would expect indeed like that WHO and partners would be facilitated to ensure that those hospitals remain operational. Over to you.
Okay, we have quite a few questions. Pam, then Gabriel, then we'll go to Abdelhamid.
Thank you for the briefing. I really appreciate it. It's Pamela Falk from U.S. News and World Report. A few questions. One is, could you give us a little granularity on the actual polio campaign in this round? In other words, who's accompanying you? Is it COGAT or other police forces? Are you how it works? And number two, the second part of that is, what is the origin of the outbreak? I don't know if you're a doctor or a doctor PhD, but can you tell us, there was one report that the strain itself came from Egypt, and also that the lack of drinking water exacerbates it, but I wondered what your take was on that. Thank you.
Okay, thank you very much. So the polio campaign is actually, it's organized, managed by a whole group of partners. And what we actually call here in Gaza, the technical committee, actually comprised of those key partners. The Ministry of Health, WHO, UNICEF, UNRWA, and many of the NGO partners. It is actually done in every, the campaign, I think I mentioned the campaign, the targets. I mentioned the way it was organized in 3 zones. So we started in the central, the central zone, where there was a focus. So the total number to be vaccinated was 591,000 children. Central zone, 180,000, 179,000, southern zone 293,000, and the northern zone 119,000. You want to reach 90% or more. That's it. And then over 2 rounds. So these campaigns are organized and really prepared, and this is incredible. It's an incredible complex exercise in an incredibly challenging environment. So first, of course, the cold chain and everything and all the equipment needs to get in, the vaccines, finger markers, and the whole lot. Then teams need to be trained for the polio vaccinations. Those are health workers, volunteers, etc. Then we have to assure that an campaign, an independent intra-monitoring campaign can take place, and a post-campaign monitoring. In every zone, you talk about hundreds of teams. I mean, like sometimes 250 teams per zone active. And huge number at fixed sites, the Ministry of Health, primary healthcare, and NGOs, UNRWA primary healthcare centers, etc., NGO primary healthcare centers, field hospitals, you name it, general hospitals, fixed sites. Then there is a huge number of mobile teams moving around, mobilizers, and then the social mobilizers, etc. There's a whole social mobilization campaign as well. So there's distribution point in every zone, depending on the size, and every morning it starts at 6:30. Vaccine carriers are distributed to all the sites, etc. And the campaign starts something like 7:30, 8 o'clock for 6 hours. There's this area-specific humanitarian pauses, which I discussed, and the campaign actually went off. And I want to make that point that with all those partners and enormous credit to all those teams. Oh yeah, one part I forgot. One of the most essential part is the micro planning. So micro planning, normally when you do a polio campaign, you plan from house to house and block to block. Fortunately, that's not possible in Gaza because there's very few houses left. We have a lot of this settlements, IDP settlements, all the I would say the ad hoc settlements all over, and it constantly changes. It changes in the first round 5 weeks ago, also through forced evacuations. So these micro plans constantly need to be adapted. And every day, the technical committee comes back in the afternoon and has a really intense meeting where they analyze all the data, but also adapt a strategy for the next day. Should we go more for mobile teams, or is the fixed site more effective, etc.? And that is constantly adapted. And against all odds, the first round was a big success, and even the second round, of course, we just concluded the third day in the north. Tomorrow there will be still some fixed sites. I don't have the details, the number of children from today in the north, but overall, it's a massive achievement, and I think, yeah, the credit to all those teams, credit to all these organizations and the Ministry of Health who contributed to that. We did a good job. You asked where the virus came from. So polio globally over the world, there's two, the world is actually on an eradication track for polio. There's only two countries where you have the wild polio virus. That's Afghanistan and Pakistan. However, in countries which are at war, strife, etc., you often see where the vulnerability is high and where you have a lot of under-vaccinated children, you get some kinds of what we call a vaccine-derived polio outbreak. And that happened in Gaza with a strain which indeed came from the Sinai. Now, to stop that, you have to do a campaign. And we had one polio case here as well. We're doing constant testing now as well. We have to improve the surveillance, environmental surveillance, and also surveillance of children with acute flaccid paralysis, etc., and do the testing there. You have to do then a campaign, two campaigns actually, 2 rounds, and try to get as close to 90% as possible. And I think, well, the end, we have to still do the intra and post-campaign monitoring, I think, but overall, an incredible achievement against many odds. Over to you.
Okay, Gabriel.
Thank you, Dr. Peeperkorn. This is Gabriel Elizondo from Al Jazeera English. A few questions, I'll ask them one by one because they're just clarification questions. The first one is, when you talk about northern Gaza, you mean everything north of Gaza City, and you're not including Gaza City in that when you reference northern Gaza. Is that correct?
That's correct.
Okay, thank you. Just wanted to clarify that. And then on al-Awda Hospital, let me back up. How many hospitals are operational in Gaza City?
In Gaza City, there is, I think there is 4 hospitals, 4 or 5 hospitals, but they are all, they're smaller and bigger. Smaller and bigger, and a number of primary healthcare points, as we call it, primary healthcare center. And maybe if I allow, let me say one positive example here, because we hear only negatives. If you look, for example, at Al-Shifa Hospital, and we all know what happened to Shifa Medical Complex, where it went and came. I've been there many times, to a large extent destroyed, severely damaged, became non-functional. And if you now look at Shifa, it functions again as a mini hospital. There is an emergency ward, there's operation theaters. They do something between 9 and 15 major operations per day. There's a vascular surgeon, thoracic surgeon, general surgeon. And we use it now again as a referral point. So all these critical patients we referred from the north of Gaza City, as I described, we referred them initially to Shifa Medical Complex. Now also amidst the rubble of the Shifa Medical Complex, you also have a little unit, a hemodialysis unit, with 25 working machines. It used to be 60, serving 63 patients twice a week, 2 times 4 hours. WHO, we're supporting the emergency medical team there. We're helping with supplies and equipment. Other parties now step in. We are thinking about how can we further expand Shifa and improve on the maternal and child health, neonatology, etc. But that is so. I just want to mention that almost all the hospitals we work with, they went to a cycle where they became, even, by the way, Kamal Adwan and al-Awda and al-Awda, but also Nasser Medical Complex, as you know, all of them went through a cycle where they were functional, partly functional, minimum functional, and for a while non-functional. And this is the incredible resilience that most of these hospitals bounce back with support of WHO and partners. If you go to Nasser Medical Complex now, it's again a partly functional referral hospital. Sorry, but I thought this was important to mention because we always only hear that, nothing is working, and that is not true. Over to you.
Thank you very much. Just 2 more very quick follow-ups on al-Awda Hospital. The question is, how many patients do you estimate being there, number 1? And the follow-up is, how long do you think it has to function if your mission is not able to get there later this week?
Yeah, sorry, I had the specifics, but then I was cut off. So on al-Awda. So what we did yesterday was transferred 5 patients and 5 caregivers. The fuel generator stopped, and they rationed it with 3 hours per day until yesterday. They kind of stopped. They have 44 inpatients, and 5 of them were referred, so they still have 39 inpatients. They have a staff of 71, and they have actually 11 doctors, 1 surgeon, and they have a number of what we call junior doctors and nurses and some 26 admin staff. The trauma burden is also there high, and it is the only, by the way, it's the only hospital north of Gaza City with a general surgeon. So really important for this trauma surgeons. So yesterday they had 79 injuries, yesterday's, and 60 or the day before yesterday, and 69 injuries when we visited there. And currently they cannot do surgical operations because there's no electricity. That's the big issue. So what I said, the director there, Dr. Mohammed, he was desperate. I know the man, and he was desperate because he had heard that we would bring those supplies, including some of the surgical supplies, anesthesia supplies from blood units, etc., and some food and the fuel. And he was, of course, incredibly disappointed that we didn't bring that and that we only could take out the patients. We promised that we will plan for other missions, and those missions, we are ready for that. And as I said, sometimes they're facilitated, sometimes they're not facilitated. They should be facilitated all the time. There should be regular missions to not only to the north, also to Gaza City and within the south. Over to you.
Okay, sorry, I think we're really, really short on time, so we'll just have Abdelhamid, and I think that's all the time we have. I'm really sorry.
Thank you so much,
Need
Doctor.
to have the other side.
Abdelhamid Sayam from the Arabic daily Al-Quds Al-Arabi. In the last month, when the Israelis started its attack to the north 1,800 Palestinians were killed, 4,000 were wounded, and hundreds of thousands are now, as you know, besieged. They don't have the basic needs to survive. So first, I want to ask you, have you seen something atrocities committed against civilians in your career with WHO, similar to that? Navi Pillay and her team put their report on attacking health facilities, health doctors, support staff in the field of health. So have you participated? Did you chip into that report? Did you report to Navi, to the independent panel or independent team on investigation? And my question is maybe a little bit emotional. What is the use to do vaccination if these children are going to be killed anyhow? I mean, just to give them vaccination to be a little bit healthy until they are killed? After 14,000 of children killed, what is the use of that? One of the centers of the vaccination was attacked, as you know, and number of children were killed. And the wing and the Shifa Hospital, or Kamal Adwan Hospital, one of them, which is specializing for children, was also attacked. A number of children were killed and wounded. So what is the use of this vaccination? Is that just to give Israel a name that it's helping in a humanitarian campaign? Thank you.
And just quickly, just so we can take one more question. Benny, do you want to ask your question? And then you can answer both. Sorry.
Very quickly about yesterday's, there was, the IDF reported that an aid convoy to Kamal Adwan was attacked by Hamas, and shrapnel hit also, and people were injured, and shrapnel also hit the actual roof of the courtyard of the Kamal Adwan. Your comment.
Okay. Let me first ask the former speaker and ask with start with your last question, because that's an important one. So why vaccinate children when they get bombed and killed anyhow? I think I tried to explain very well. First of all, I think that if you know polio victims and you know how easily you can prevent that, you don't want any child to get polio. So I think first, when you can prevent it, you do that. So that's my first thing. But I completely, agree with the point, and I want to stress that that's why I started with health in the North of Gaza and health overall. We are not just supporting vaccination. We're supporting health overall. We are supporting, if it is trauma support, primary health care, referral care, etc. We are trying to help assure that I often hear the health services are collapsed in Gaza. I don't like that term. In the north, definitely north of Gaza City is dramatic. I described it. But collapse means that there's no health services. It's incredibly impressive with the resilience there is that there are still many of these hospitals providing partially services, that there's many primary healthcare points, that it's the Ministry of Health, NGOs, other partners, etc. It's the health workers who do that. And even when a hospital or facility became non-functional, that it becomes functional again with support. And as WHO, we've been supporting from the start of this crisis in a massive amount medical supplies, trauma supplies, supply for non-communicable diseases, oncology drugs, even for mental health, psychotropic drugs, etc. Fuel for the hospitals, bringing in EMT, emergency medical teams, which do a really fantastic job in assisting and building up and being linked to the system. And more. Is it enough? No, I think we all have to be modest, so I completely agree there. But don't say that, okay, why just vaccinate and when nothing happens? No, it should be and. We should focus in all over the support to the broader health sector, and that's the key focus. And the polio campaign is for me just one key activity. I want to be very clear. It's about the broader health sector, basic health service, referrals health service. How do we make sure that the health system in Gaza remains functional? partly functional, minimal functional, or fully functional. And we all hope to restore it to fully functional. There's one positive thing I think of. Gaza has a lot of fantastic health workers, very well educated and incredibly capable. And the health service before this crisis, I don't say they were perfect, but they're relatively good, including some of the public health services, vaccination coverage over 90%. So there's a lot of capacity, and we have to make sure that we facilitate and we support that as good as possible. Now, on your other question on the attacks on health. So WHO has a mandate that in every conflict, acute, chronic, etc., we monitor, analyze, and report on attacks on healthcare. It's all framed. It's mandated by our member states. But I want to stress, we are not a crime investigating bureau. We don't attribute those strikes, atrocities to anyone, because we are a health organization. I'm a medical doctor. I'm a public health specialist. I'm not a crime investigator. So that's the role. You ask, have I seen in my career? Unfortunately, I was 7.5 years the rep in Afghanistan. I worked in Central and Southern Africa. Yeah, I've seen many atrocities and many grim scenes. But I must say that over the last year, what I've witnessed and in Gaza tops it all. And then on the war side, and sometimes I felt you were specifically also in December and January. You were in if you were a small minor actor in a World War I movie or something like that. Yeah, incredibly sad. The last question was about is that I was part of that mission, and the only thing is what I could say, there was definitely bombardments close. There was an explosion, and I cannot say. I mean, I saw the reports. I don't know. Again, we are not the UN. We are not investigating those events. So I don't know who to. And as I say, we never attribute that to anyone, because that's not our job and that's not our professional capacity and background. With us, let's say with the team, no one was hurt and nothing happened. I think we also probably getting used to all these bombardments and everything happening around. And again, what I said, after this, when we left, and we were gone from Kamal Adwan and al-Awda with all those patients, yeah, it was reported to us that there was a strike on Kamal Adwan. Reported. So we have not witnessed that, and according to the reports, that a third floor was hit, I think, and 6 children were injured. That's what was reported to us. Over to you.
Rik, thank you very, very much. We know we've gone over the limit with you, but really appreciate you taking the time. Thank you, and please pass on our thanks to all our colleagues, your colleagues, for what they're doing. And we'll hope to see you back in the briefing room soon. Take care.
Thank you very much. Bye-bye.
All right.